Glad to be back at it again with you on this thing called the Just Start the Conversation podcast. It's brought to you by St. Luke's Penn Foundation. You can visit pennfoundation.org with Amie, Alanson, Dundon. As always, Jody McLeod-Mismer in the bullpen right now, just staying warm for the next podcast after this one. But Amie, Alanson, Dundon is here, and we have Rob Brands here with us as well, a U.S. Marine Corps vet. He is the program director for Victory for Veterans. Veterans Day just around the corner. So to Amie and Rob, good morning. Thank you both for joining us this morning. Always appreciate it.
Good morning, Crockett.
Good morning, Crockett.
Very excited to talk to you today, Rob, because first of all, I want to tell you I did some digging on this program, and it's amazing. Obviously, there's some statistics I'm sure you're going to tell us about Carbon County in particular and the suicide rate with veterans there. This is an amazing program, so I'm going to let you just kickstart and tell me a little bit about it as the program director. Victory for Veterans, what is it?
So Victory for Veterans, we work to reduce veteran suicide, and we do that primarily. We got a grant, the Staff Sergeant Fox Suicide Prevention Grant that we use that provides money that allows us to have a program like Victory for Veterans. And what we do is, our biggest thing that we do is we provide peer support to veterans. And peer support is nothing more really than just talking about our lived experiences. So the peer support helps us to establish some trust really very quickly with veterans. So the veterans that we provide peer support to are provided peer support by veteran peer support specialists. So all of our peer support specialists that are providing support to veterans are veterans themselves. So we're really able to connect very quickly and establish that trust, which we have found to be crucial for success. And we also have a peer support specialist that deals with family members who is not a veteran, and she provides to the family members. She comes from a long history. A lot of family members have been in the military, so it's worked very well for us.
Amie, can we touch on a little bit? We talk so much about when we're talking about mental health, how big that first step is to get the help that you may need. Obviously, we've talked about how therapy and anyone that you can talk to that's a professional that can wrap your arms around you is amazing. That element of that veteran on veteran interaction, just how important that is, and just from your experience and your history, maybe some of the stigma around mental health and veterans that you've experienced.
Yeah. So when I think about veterans' mental health and I think about veterans in general, it's very, very similar to the work that we do with first responders in the first responder community, right? And so it's, in terms of stigma, that's a very similar initial belief, if you will, that, you know what, I'm tough, you know, my training is to suck it up and run into the face of danger and fix things, right? So they're really military folks and first responders are not built to reach out for help. They're the helpers, right? So it is super difficult to engage veterans. It's turning a little bit, but it's still very hard. Turn them towards help, right? And you know, Rob, as a former Marine, can attest to the fact that the kind of the belief of military folks is that mental health is a weakness.
Yeah, very true. You know, veterans are just taught to figure it out. Specifically, veterans are trained for combat, and in combat, you may not have a whole lot of support at different times when you need it. So you rely on other veterans, but for veterans to really seek help outside of the veteran community doesn't happen very often.
Yeah, and I think yes, and I think we need to also say that, you know, people think, well, if you're in the military or you're a veteran, you must have post-traumatic stress disorder. That's the big mental health issue that we tend to treat. And while it's true that the prevalence of post-traumatic stress disorder is high for folks that have seen active combat, you know, it's certainly equally important to just talk about anxiety and stress and depression, as certainly things from doing this podcast, we certainly know that those are prevalent in the general population. So they're going to be prevalent in the military population, in the first responder population. And it was interesting to me when when I was years ago, when I was kind of learning more about veterans, that, our highest suicide rates for folks in the military are infantry, armor and amphibious, and then combat engineering. And I was thinking about that, and I was thinking about, gosh, why those things? But I think, I think we know that suicide doesn't discriminate. So it certainly finds veterans wherever they're at, and 22 veterans commit suicide a day in the United States, a day. So.
Wow.
It's 1.5 times higher than that of the general population. So it's important, if we can get folks to come in and start talking about this, we can get somewhere. And oftentimes, to Rob's point, they're more willing to talk to a fellow vet or a fellow military person, than they often are to come see me as a non-vet, for therapy. If Rob can get them in the door, and then they decide, they really could use some clinical psychotherapy, then the Victory for Veterans program will connect them, with the folks that they need.
Yeah, many times we'll meet the veterans where they're at, and we'll have a pre-engagement period where we'll meet and we'll talk, not necessarily in an office environment. It may be on a hike, it may be on a walk, it may be in a park, somewhere where the veteran does not feel pressured and they feel a little bit more comfortable, veteran to veteran, and they will talk and they will start to reveal some of the things that they might be struggling with. And they also know that from another veteran, they're not going to be judged. And certainly, as I said before, we build that trust fairly quickly. And as we continue to move forward, they are then also more trusting of other people that we're trusting of. And so we kind of help to bridge that gap really to folks like Amie, which is extremely helpful.
I think one of the things that we really bang the drum on in this podcast quite a bit, Amie, is trying to meet people where they are. And so certainly for veterans, having another veteran there to at least have that initial conversation with you has to be so important. So the eligibility for the Victory for Veterans program, what does that involve? What does that include? Is that somebody who's currently enrolled? Like, what kind of status do you need to have with your military background in order to get some information from Victory for Veterans?
So first off, we'll give information to every and all veterans. But for our specific program, you have to be a resident of Carbon or Schuylkill County. But that's to be in our program. That doesn't mean that we can't provide resources to you if you're outside of those counties.
Sure.
And then there is a screening process that we go through that we deal with the VA to help to establish that eligibility. I would say that the criteria are not very stringent in order to get in for this program.
Amie, we've talked about support systems quite a bit in all the different walks of life that we've talked about in kind of like this mental health journey. The support system for a veteran, and I feel like their family, first of all, I mean, talk about, especially if you have a veteran who is deployed, you have a son or daughter who is out somewhere, anywhere in the world, chances are your heart's already racing a little bit as a family member to begin with, or a loved one to begin with. They come home and you recognize that they're dealing with quite a lot. Can you just go into the role that the family plays for a veteran when they finally get back home, even if it isn't necessarily from deployment, if it's just at home? And then also the role that a family member can play, and I'll kind of look to both of you on this one, the role that a family member can play in helping someone find a program like the Victory for Veterans program.
Yeah, well, first of all, I forgot to say thank you for your service, Rob.
Oh, you're welcome.
Yes.
You're very welcome.
Sincerely.
Sure.
Absolutely, yes.
And thank your family, right? And
Sure.
could be, because when you said that, Crockett, I thought, it's so true that when we have a loved one who's actively serving in the military, we're serving alongside of them as a family. We're not there with them, but we are going through the emotions of that person being in a foreign place, and that person may be dealing with life, away, your family's dealing with life away from you, and your husband or wife or partner who's left back at home to take care of everything without you, there's stress on both of you for that, in terms of, the person who's in the military is worried about the family and are they doing okay without me, and what I should be doing more to help them, and that guilt of not being home. And then the family of, I don't want to stress him or her out. She's got enough to worry about in Iraq or wherever that person is. So they're trying to do that balance of how to maintain a healthy relationship long distance, how to maintain a healthy relationship with the normal stressors of relationships long distance, and the uncertainty sometimes of being able to even talk to your loved one if they're in a position in the military where they're in some sort of top secret stuff and they can't tell you even where they are, which happens often. So really, it's important for a family back home to have support. There are lots of different organizations that families can connect with for families of folks that are actively in the military. There's apps. There's tons of apps on your phone that you can just type, go into your app store and type in, family of military, and there'll be apps that come up that can help you connect to resources. And, but I would say, if you don't know where to start and you're a family member, talk to, call the VA. The VA can give you a list of supports, right, that are out there for you as family members. It's okay to go to therapy to talk about the stress of having a loved one who's overseas, and
we refer a lot of those folks to St. Luke's to therapists, counselors, stuff like that, because as veterans, I can't really identify with what those challenges are because I was the person deployed, right? So we want to make sure that we give that family member the best support possible. So, in referring these family members to St. Luke's has been, again, I would say very successful in being able to find help and other additional resources that would be available to them.
I think whenever we're having these conversations, as we talk about family, as we talk about the veterans themselves, just the community that is veterans. For you, Rob, obviously Marine Corps vet yourself. Again, thank you for your service. I'm going to keep saying that.
Sure.
Just the community that is veterans of any military background, I feel like has to be such a strong bond. And we talk about that quite a bit, Amie, in this podcast, of just how leaning into people who you're familiar with in a community can be such an important thing. I have to think for veterans, it is so crucial in a position like yours, Rob, as a program director of Victory for Veterans. Just it feels like there's such pride with veterans, and that could be part of the stigma here, is that the pride, I can do it myself, I can handle this myself, I can do all that. The community that is veterans, that special community, just the role that they play in your life as a veteran yourself, but also as a director of a program that's trying to help people who may be having some problems.
Yeah, I think one of the easiest ways I try to explain it to them when I first started to talk to a veteran, because of course, until we have some conversations, they're a bit leery of me as well. And I try to explain to them that, there is nothing wrong with asking for help. And, if we were in combat and I needed help and I yelled for help, I always ask that veteran, would you help me? And their answer is always yes, immediately. And I say, and if you call for help, do you think I would help you? And the answer is yes. And I then tell them, it's no different in civilian life. If you need help, you need to ask me, or you need to call me. You need to let somebody know. And I'm going to come help you, just as any other veteran would. And so that's how we start those conversations, and we get that trust by them understanding, I'm safe talking with Rob, or I'm safe talking with these veteran peer support specialists, and I'm not looked down on, I'm not looked at differently. So that starts those conversations, and that's what really gets the ball rolling towards identifying what they're struggling with and perhaps what goals they'd like to work on. And that's really one of the other things we do, is we establish goals with these veterans. Many of these veterans, They left a job in the military being very young where they had a lot of responsibility. They may have been responsible for 8 or 9 people's lives. And they got discharged. They come back to the civilian world, and they start out in a job maybe where they don't have quite that much responsibility. So they need to feel as though they have purpose. And we call it going from hero to zero. So at one point in their life, they had a lot of responsibility, and when they get out of the military, they're not a zero, but they kind of feel that way a little bit. So we try to work with them to really get them to understand that that's not the case.
Amie, one of the things often in this podcast, we talk about kind of maybe the shortcomings around the mental health world, whether that's financially or the stigma that might be behind it or the backing that some of these programs deserve. For something like Victory for Veterans that feels like it just makes a whole lot of sense given the circumstances around what the program is. You're immersed in it with Rob over there at St. Luke's. Where would you like to see a program like this grow? How can it grow? You have, again, you don't get a much better team than a military team.
Yep.
So how can we take the components that are already here and developed and turn this into something that, we mentioned Carbon County has the highest veteran suicide rate in Pennsylvania. How can we start something that's in Carbon County and grow it to all throughout Pennsylvania and in general throughout the country to kind of help take care of our veterans even more?
Crockett, if I had a magic wand, the things we could do.
Sure.
This Victory for Veterans program is amazing, and it's completely grant funded. Okay, because let's go back to payers and regulators and mental health inequity and lack of parity for mental health, physical health. There's, no insurance companies knocking at the door to say, let us throw money at you to do this for our vets. They're saying, this is really cool. Hope you can keep finding grants to sustain it, right? So which floors me, right? And Rob and Jody and I have talked about this. And, if we say to our, and we're coming up on an election, soon. And if we say to our government officials, listen, folks are more likely to die by suicide than in combat. Like, let's process that for a minute, right? So as mental health and physical health professionals, we need buy-in from the government, from our payers, from our, Medicare, Medicaid, and then our commercial insurance payers to say, you know what, we'll pay for veteran peer specialists to go out in the community and meet with people. We're gonna make that part of our reimbursed, services for mental health. That's what it's gonna take. Now, there's so many fantastic people in our community here in Eastern Pennsylvania, but I know all over the United States. So wherever you're listening to this, you can find your local veteran and first responder champions because they're everywhere, right? We have local first responder champions that are like, we're in, man. We're as local first responder champions, we're going to help connect people to you with Victory for Veterans, and we need you to kind of start coming to some of our meetings. So people are doing it to make it successful because it's the right thing to do. It's not sustainable financially. It's sustainable because we're saving lives.
Rob, I'm gonna ask you to elaborate on that a little bit. So as we get kind of a more national scale answer there from Amie, for where you are, Victory for Veterans right now, what do you feel like can kind of help take your program to the next level in a local spot where certainly the statistics show it feels like something that needs some big old arms wrapped around it?
Well, I think certainly there is a need. We would all agree that the need is there. And, I would echo a lot of the things that Amie says, regarding the payers. Many of the resources that we reach out to that help support these veterans and their families, they also are not getting paid. So it seems as though a lot of these organizations that want nothing more than to help these veterans and their families also are not being paid, unfortunately, or being reimbursed. So I think if just by collaborating with other organizations and kind of coming together to make sure that we're overlapping and that the support that we're providing, we peer support's our big thing. So there are other organizations that don't do peer support, but they may do housing, for example. So we just continue to collaborate with those other organizations to make sure that we're providing a complete package. And as far as how do we continue to move that in different areas, different locations, I think just by continuing to meet with veterans in those areas and try to gain support from either whether it be county or state officials, try to get some support for those programs in other areas once those needs have been identified. And of course, like I said, we already have identified those needs. There's no place that need doesn't exist right now, I don't think.
I think based on the role that you're in as a program director of such a wonderful program. Again, I want to reiterate, I'm going to keep coming back to this. Victory for Veterans is free, community-based. So if you are a veteran, you're looking for information, certainly we have got the place for you to do it. I'm interested, you're a Marine. I won't give the specific time, but I saw the video and know how long ago it was.
He's 32.
He is, that's right. Can we talk a little bit about the evolution on programs, though, from the time since maybe you've been a Marine until now? As we've already kind of talked about how we'd like to see this thing grow, we have to pay respect to where it's come to this point. Maybe just your experience coming out of the military until now. You obviously felt the need to be a part of a program like this and lead a program like this. So maybe just a little bit of insight there to give some people some more information, kind of where you saw it when you started and to where it is now.
Yeah, so when I got out of the Marine Corps in 1991, there were very few programs available. I had just came back from the Gulf War, and there was not a lot of support. And I know for me, trying to readjust kind of back to civilian life, there wasn't a lot of support. A lot of people weren't talking about it. You just put your head down and kept moving. And so as life went on, I saw other veterans that were experiencing the same thing. And it got to a point to where, some of these other organizations started to be born, and they started to help veterans. And you could see they were making a positive difference. And so I thought to myself, wow, veterans need quite a bit of help in so many different areas. And so I thought, now's the time to do something. Because I know back when I got out, there really wasn't a lot. And if you even go back further, like the Vietnam vets, they really had nothing as well. So I think that over time, since I've gotten out, it's evolved quite a bit. We have a long way to go, but it's evolved quite a bit since when I got out, when I was discharged.
Can I ask a question?
Sure.
What was the hardest part for you transitioning?
I think the hardest part for me was being able to trust, because in the military, there's a mission, and everybody's working on that mission. Everybody's moving in the same direction, at the same speed, and with the same passion. In civilian life, many people are moving in different directions at different speeds, some with passions, some without. And so that was hard for me to adjust to, because I'm used to all of us being in the same game at the same time.
Yeah.
And so that was incredibly difficult for me. And I find that with most every veteran, really.
Which is so interesting to me. Thank you for sharing that, because
Yes.
oftentimes folks like yourself come out of the military and transition into other similar professions where it's also, whether it's corrections officers or police officers or security officers, because it almost seems to me like that's safe. That feels like a safer place for you in terms of, okay, I'm on this side of the law and I have a little bit more control.
So prior to St. Luke's, I was a correctional officer. And then prior to this program, I was the safety and security manager for the St. Luke's Monroe campus. So I can completely understand that rationale. What I would say is I think most veterans are very comfortable operating in chaotic situations. That's when we do some of our best thinking. And, so when you get to a place where it's not quite so chaotic, we're really not sure
what to do with that.
How do we fit in here? Is our thinking the same as everyone else's? It's not most times.
Which often plays out in the family too. We
Sure.
talked about family earlier, right? When you start to transition home, you're coming into a family unit that doesn't operate the way that your military unit operated with.
That's very true. And you have to remember that even though this veteran is coming home, they are still in what they consider to be a position of authority of a leader. And so they've not been leading the family for the last year. And they come home and they immediately try to assume that, which causes problems. And again, they're leading their children. They're not leading a platoon. So there's just a lot of challenges there.
Oh, Rob, I have to tell you, I appreciate your vulnerability in answering that question there from Amie, because I think that felt like an answer you could probably hear from a lot of veterans, and I'm sure you do with the Victory for Veterans program. So again, I want to thank you for your service. I know Amie mentioned it before as well, a U.S. Marine Corps vet. I just want to share this information. If you are a veteran in crisis, you can call 988 and press 1 or text 838-255 to get some information. If you're looking for help, of course, the St. Luke's Penn Foundation is an excellent resource. The Victory for Veterans is an excellent resource, whether you're the veteran themselves, you're a family member, significant other, somebody, you're a friend, and you're just thinking, I think you need to go talk to somebody. Certainly plenty of places to go ahead and get some research and start that process. So Rob, again, for your service and your vulnerability today, certainly appreciate that. And for the work that you're doing as the program director of the Victory for Veterans, thank you for what you do.
Thank you.
And Amie, as always, an excellent conversation today. We're just going to keep throwing out this big old set of arms that we've got and try to wrap around as many people as we can. And so thank you, as always, for a great conversation. I appreciate it, my friend.
Thanks, Crockett. Thank you as well.
It is the Just Start the Conversation podcast. It is brought to you by St. Luke's Penn Foundation. You can visit pennfoundation.org. Again, the Victory for Veterans program. If you are a veteran in crisis, call 988 and press 1 or text 838-255. For Rob Brands and for Amie, Alanson, Dundon, this is the Just Start the Conversation podcast.